When you first came into our office, we took x-rays. I want to remind you what we were looking at and why those images are so foundational to your chiropractic care. X-rays give us something incredibly valuable, an objective visual picture of what your spine's health and structure look like. Without them, we're guessing. With them, we can see exactly where misalignments exist, how significant they are, and, most excitingly, how much they've changed or corrected over time. Let me walk you through the key things we look at on a spinal x-ray. First, we look at alignment. In a healthy neck, when it's viewed from the side, there should be a nice, graceful C-shaped curve called a lordosis. That curve curves backwards. The curve is not cosmetic, it's an engineering feature. That curve distributes the weight of your head, which weighs about 10 to 12 pounds, evenly over the spine. Without that curve, your head's weight shifts forward, and so for every inch your head moves forward of its ideal position, it can effectively add about 10 pounds of stress to your cervical spine. So a head just 2 inches forward, which is extremely common in our screen-heavy world, puts about 30 extra pounds of force on the neck and the upper back. That's like carrying a bowling ball on your neck all day. Second, we look at disc height. Healthy discs look like nice, even spaces between the vertebrae on an x-ray. Narrowed disc spaces tell us there's been degeneration, often from years of abnormal pressure from postural misalignments. Third, we look at the position of each vertebrae relative to its neighboring vertebrae. A vertebrae that's rotated or tilted even slightly can be putting significant pressure on the nerve root exiting at that level. Now, here's the really exciting part. At your 3-month mark, we're going to take a second set of x-rays in the same positions as your first or originals. We'll place them side by side and look at what has changed. In my years of practice, this is one of the most rewarding appointments we have because most patients are genuinely amazed by how much structural change is visible in just 12 weeks of consistent care. Your x-rays are not just a snapshot of a problem. They're a baseline or roadmap and eventually a before and after story of your healing. We'll see you soon. If you have any questions between now and your next visit, our team is always just a call or text away. We've got your back every step of the way.